Hello everyone, greetings of the day. So far we have seen what nutraceuticals are, how are they classified, how these products are in big demand in the market. Everybody is using different kinds of nutraceuticals. And now there is a new segment which is in big demand. These are the oral hygiene products which are used as wellness and nutraceutical products and occupying a large market shelf. So, I am going to introduce to you the herbal oral hygiene products. What are different types of oral hygiene products that are available in the market today and what are they used for? Why and what is the importance of these products? So, an oral hygiene product are formulations or devices designed to clean the oral activity to prevent dental diseases and maintain overall oral health. They include products like toothpaste, mouthwash, toothbrushes, dental floss, chewing gums and herbal preparations that help to remove plaque, control microorganisms, freshen the breath and protect the teeth and gums. Why are they becoming important, or why is it important that we use a oral hygiene product? To prevent dental diseases. It helps to prevent dental caries, gingivitis and periodontal diseases which are caused by plaque and microbial growth. So, it is said earlier we used to believe that diseases arrive from the gut. Today this still remains true that diseases arrive from the gut, but there is a strong evidence which shows that there are a lot of diseases which are linked to oral microbiome. So, the microorganisms present in the oral cavity may lead to heart diseases, mouth cancer, diabetes, stroke, gum diseases, tooth loss, bad breath and dental caries. So, it is very important to use a oral hygiene product to protect against all these diseases. So, these products maintain oral health, they control bad breath which is halitosis. Not only protection, but they are also used for aesthetic, which improves a person's confidence and social importance. So, they give you a clean white teeth with fresh breath, improved appearance and social confidence. Systemic health connection. Poor oral hygiene is linked with conditions like cardiovascular diseases, diabetes, respiratory infections, and hence these oral care products support general health. It improves digestion. For chewing, which is the first step of digestion, and absorption starts right here. So, absorption of nutrients, some of the most important nutrients, starts in the oral or buccal cavity. So, healthy teeth, gums ensure the efficient chewing and saliva mixing. Early detection of diseases. Oral cavity often shows early signs of nutritional deficiencies like infections and systemic infections. So, many systemic infections may arise from the oral cavity. Regular oral hygiene and checkups help in detecting these diseases at an early stage. There is an improvement in quality of life once regularly these oral hygiene products are used. It prevents pain, tooth sensitivity and discomfort. It allows proper speaking, chewing and smiling, which makes your daily life better. It prevents dental and systemic diseases, promotes healthy gums and teeth and ensures a fresh breath. It supports digestion and enhances overall quality of life. It also brings about a balance, eubiosis, by balancing all the oral microbiome. It maintains equilibrium between beneficial and potential harmly microbiomes. So most of these synthetic oral washes kills all the bacteria, the good and the bad. So there is one advantage using an natural oral hygiene product is that we maintain the useful bacteria in the mouth. It competes with pathogen preventing overgrowth, produces antimicrobial compounds. Some of the herbs used in an oral hygiene product may have antimicrobial activity, thus supporting immunity and interacting with the host defense mechanism. They help as nutrients and help break down food debris, producing short chain fatty acids and maintaining an excellent oral pH. There is a systemic impact where it influences the gut microbiome and overall health via swallowed saliva and systemic circulation. So when balance is disturbed, which is called dysbiosis, the pathogenic microbes thrive in the oral cavity and they start dominating, leading to oral and systemic diseases. So once this oral disease starts, it gets into the systemic disease through the oral cavity or buccal cavity by directly diffusing into the blood. Oral diseases like dental caries, periodontal diseases like gingivitis, periodontitis, oral candidiasis and halitosis all arise from the oral cavity. Systemic diseases like cardiovascular, diabetes, mellitus, respiratory infection. So there is now enough scientific data to prove that these systemic diseases are somewhere or the other linked to oral microbiome. Adverse pregnancy outcomes, neurological conditions and cancer risk may also arise from the oral microbiome. Hence, maintaining an oral hygiene with a balanced diet, avoiding smoking and excess alcohol, along with the use of herbal oral hygiene products is used to restore the balance. So examples of these oral hygiene products, these may be different types of oral hygiene products. Toothpaste which help in cleansing and protective action. So you must have seen and heard of a lot of products, herbal products in toothpaste, including charcoal and common salts. Mouthwashes, toothbrushes, toothbrush also has charcoal, neem and some of the natural ingredients. There are dental flosses, chewing gums, natural cleansers with herbal ingredients. So like I said before, they give a protection against dental caries, gingivitis, periodontal diseases, maintains oral aesthetics and a fresher breath, and thus supports an overall systemic health also. So these are some of the products which you see in oral hygiene products. These are plant based formulation, natural, safe and effective as compared to the alternative synthetic products. It focuses on prevention of dental caries, gingivitis, halitosis and overall health hygiene. What are the advantages? They are natural antimicrobials. So herbs like neem, clove, meswak, triphala, which is a combination of 3 fruits, amla, harda and beda, tulsi, they possess antibacterial, antifungal and antiviral properties. So making a product with these herbs and many more may give the advantage of maintaining the oral microbiome. They have comparatively fewer side effects compared to chemical agents like chlorhexidine, which may cause tooth staining or altered taste, and herbal products are generally milder with lower risk and they have natural tastes. There is holistic healing, very important. So holistic healing is where it tries to balance all the tridoshas in the body. So many herbs have anti-inflammatory, antioxidant and analgesic effects, and they try to maintain a balance of all the tridoshas in the body. There is sustainability and biocompatibility when these herbal hygiene products are used. There is a multi-benefit approach where herbal formulation often contains a blend. It strengthens the gum, freshens the breath and it remineralizes the teeth naturally. So consumer preference and cultural acceptance is more with these natural products. There is an adjunct in systemic health. So these products when used also improve the systemic health. Like for example, curcumin, when it is part of the formulation, reduces oxidative stress and inflammation, thus potentially benefiting not just oral health but systemic wellness. So these are some of the herbs. Neem, clove, babul, miswak can be used in toothpastes. Tulsi, triphala, aloe can be used in mouthwashes. Again, neem, licorice can be used in chewing sticks. Trikatu, triphala and vajradanti can be used in herbal powders. There are a lot of gels and oils which are made with clove oil and peppermint oil. So these give an array of benefits starting from antibacterial to antifungal, prevents plaque, strengthens the gum and teeth, provides natural freshness when used. They are cost effective and widely used. Let us look at some of the examples. So herbal toothpaste, a neem toothpaste may have neem, babul, clove oil, menthol and tulsi, and this when used for daily brushing prevents cavities, gum problems and bad breath by offering antimicrobial protection, strengthening gum, can provide analgesic and antiseptic effect. So traditionally in India, clove has been used for toothache and oral cavities. A mouthwash made with triphala may have additional tulsi, aloe vera and peppermint oil. This also helps in reducing plaque and gingival inflammation, gives antioxidant activity with healing properties and provides a refreshing breath. So this is used as a rinse or after brushing and after every meal, which prevents halitosis. So prevents bad breath and gum infections. Some chewing sticks like miswak or neem stick, so these may be used as an extract chewing stick. It may be used in natural forms like sticks like this, or they may be used in some different kind of formulation, and they act as natural toothbrush, mechanical cleansing of teeth, provides antimicrobial and strengthening of gums. So these are seen sold in the market in fresh forms. Dental powders like vajradanti, which has triphala, black pepper, rock salt and clove also added to it, cleanses teeth, strengthens the gums, acts as a natural abrasive and helps in removing plaque from the teeth. It provides antimicrobial and anti-inflammatory effects and may be applied on gum and teeth with either finger or brush. Other herbs which can be used in formulations are neem, which contains azadirachtin and nimbidin, which are responsible for the antibacterial activity, and it inhibits Streptococcus mutans, which is the main caries causing bacteria. It thus reduces plaque and used as anti-inflammatory and may act as natural toothbrush when the twigs are directly chewed. Clove has been used in India time immemorial for toothaches and dental cavities, and this has a compound called eugenol, which is used as analgesic, antimicrobial, antiseptic and anti-inflammatory properties, and it also provides a relief in toothache. Turmeric, a slight side effect is the staining properties, but when used in mild and moderate quantities may act as a very important anti-inflammatory and antimicrobial agent, reduces gingivitis. So, may be used as oral mouthwash or may be added to warm water and may be used as mouthwash. And very important is it prevents the oral microbiome biofilm formation and is useful in what we call quorum sensing in modern day science. Licorice is another herb which can be used in oral hygiene products, and these are different types of nutraceuticals which can be used. Glycerin and licoridin inhibit oral pathogens. It may act as anti-cariogenic and anti-plaque formation, reduces malodor in the oral cavity. Holy basil, tulsi or Ocimum sanctum, which contains eugenol and ursolic acid, act as antibacterial and antifungal agents, and it is an important nutraceutical in oral hygiene. It prevents dental caries and bad breath, acts as an immunomodulatory and also helps in strengthening the gum health. Miswak, original traditional oral hygiene product which naturally has fluoride, silica and sulfur compounds, and it is generally used in its raw or natural form, strengthens gum, prevents plaque and freshens the breath. Aloe vera, which contains anthraquinones, used as antibacterial and healing effect. Triphala, a combination of these three fruits, amla, harda and beheda, they are rich in tannins, gallic acids, act as antioxidants. The tannins present act as antimicrobial and as astringents, and thus help in maintaining the oral hygiene. Guava leaves, which have a lot of tannins, they have flavonoids. So, quercetin, flavonoids and tannins together shield against the harmful bacteria in the mouth. They act as antibacterial, astringent and anti-inflammatory. Fenugreek or methi, which has diosgenin, alkaloids and flavonoids, also give an antioxidant shield and an antimicrobial shield against these oral pathogens. They help in strengthening gums and reducing inflammation. Methi also has a lot of mucilage, so it helps in giving a coat and protection against any kind of inflammation. So, these herbs work through a combination of antimicrobial, anti-inflammatory, analgesic, antioxidants and astringent effect, and they help in reducing plaque, gingivitis, caries, halitosis and oral infection, thus promoting an overall health. So these are few of the examples of products which are present in the market. Dabur red toothpaste, which has clove oil, pudina and sattva. It also has sunti and pipali, helps in strengthening gums and prevents toothache. The Patanjali Dantakanti, which is made of neem, clove, babul, haldi, pudina and triphala. Vico Vajradanti, which we have been hearing since our childhood, and one of the oldest oral hygiene product made of Vajradanti, clove, babul, dalchini, bakul and amalakai. It strengthens teeth, prevents gum bleeding and natural astringent. Himalaya drug has the Himalaya sparkling white complete oral care with meswak, neem, pomegranate and tefala. And Dabur's meswak also has become very popular, where it has salvadora and persica extract. There are some mouthwashes which we see commonly on the market shelf. Himalaya mouthwash with neem, pomegranate and meswak. Colgate's Veda Shakti, which has clove, tulsi, eucalyptus, mint oils. Ayush, Hindustan Ayush, which has launched Ayush Kwatha based herbal mouthwashes, rinses. Chewing sticks, which I mentioned earlier, and there are some Ayurvedic tooth powders, Danta Manjans, Vajradantis, Churnas, which are present in the market. There are some gels and lozenges which help in healing oral ulcers and soothing gums, and lozenges like licorice which are used to maintain oral health. Products like Ayurvedic oils which can be applied in the oral cavity, which help in reducing the plaque and bad breath. And these products are used as antimicrobial, anti-inflammatory, astringent and analgesics. Thus, herbal oral hygiene products provide safe, natural and effective care for maintaining oral health. Oral microbiome these days is becoming very important, since it leads to many systemic diseases, and when these herbal oral hygiene products are made, they combine traditional knowledge with the modern practice and thus provide a holistic dental oral care. Thank you.